Good afternoon, and thank you for joining us for another edition of To Your Health here on GBMC Facebook Live. I am your host, John Lazaru. Today we're going to talk about a very sensitive subject matter, actually two subject matters, sexual assault, and also we're going to talk about child abuse. For those of you, maybe you know this, maybe you don't, but there are approximately 320,000 cases of rape, or victims of rape and sexual assault in the U.S. yearly. That is an astronomical high figure. But the other one that's of a concern is that 1 in 10 children will be sexually assaulted by the time they reach the age of 18. So joining us today to talk about sexual assault and also child abuse is Laura Clary, our clinical program manager from the Gbmc Safe Program. Laura, I want to thank you for joining us again. Appreciate you being here.
Thank you for having me again.
Laura, I know we met a couple of months ago and we spoke about a myriad of subject matters, but let's stick today with sexual assault and child abuse. For those of you also, just so you know, that April is Sexual Assault Awareness Month, and it's also Child Abuse Prevention Month. I think I got that right?
Mm-hmm.
Right? So, Laura, thank you for joining us again. We got a lot of things to get to, so we'll get rolling. Let's start off first. Can you explain to our audience and those that are joining us on Facebook, what is the Gbmc Safe Program and what does SAFE actually stand for?
So SAFE stands for Sexual Assault Forensic Examination Program, and basically what our program does is provides special medical forensic services and crisis counseling for patients that come in who have been a victim of sexual assault, domestic violence, intimate partner violence, human trafficking, and child abuse.
So for yourself and your colleagues that work in the SAFE program, what kind of training do you have to go through to be involved in this field?
So first and foremost, we always say we are registered nurses. Our main goal is to take care of the health and well-being of our patients. So all of the nurses that are in our program are registered nurses as well as forensic nurse examiners. We are all certified through our Maryland Board of Nursing, and it includes a bunch of different requirements. So you have to take an accredited course, which is about 40 hours of didactic classroom time, as well as some clinical requirements, working with the Baltimore County Police Department, with the crime lab, doing some share time with them, as well as doing a few months working with an experienced precepting forensic nurse until you really feel comfortable being able to take care of these patients independently.
Okay. So we talked about sexual assault. Can you give us a clear definition of what is sexual assault? And also, can you enlighten the audience and myself on some of the signs or some of what you should look for in a friend or a family member that they might have been sexually assaulted?
Sure. So sexual assault has many different forms, and how we think about it is there's any type of sexual contact with someone else without the explicit consent from that person, or done by force or coercion. When we see patients, we always say there's really no right or wrong way to react to trauma. Everyone handles these situations differently. So things that we tell people to look out for are, first and foremost, if someone comes to you and says that they were a victim of sexual assault, the first thing you should do is tell them that you believe them and that you're there for them for support, because that's really, really important. But things you can look for is if you have a friend or a family member that was maybe really engaged in a sport or another activity, and you start to see them becoming isolated and turning away from things that they previously enjoyed doing. If you notice that somebody is starting to use drugs or alcohol or has a really abrupt change in their personality, it may be something to initiate a conversation to see if something more is going on. Everyone kind of discloses abuse and assault when they're ready to. There's no right or wrong time when they do that.
Joining us today is Laura Clary, Clinical Program Manager for our SAFE program, Sexual Assault Forensic Examination. That's the acronym there. I encourage you all that are watching us on Facebook to please send in your questions in the comment section, or for privacy reasons, please feel free to private message us on Facebook. And I encourage our audience members who are here today to please raise your hand, and my colleague Mindy over there, she'll be able to get your questions and we'll be able to ask Laura those important questions and get some good information today. Laura, we talked about sexual assault. I know Later on, as a matter of fact, this coming Saturday, we have the Walk a Mile in Her Shoes event.
Yes.
Can you just talk a little bit about that event and what its goal is and its purpose?
So it's a super fun event. It's held right at the beautiful GBMC campus. And basically the goal is not just to raise funds for our program. So we are nonprofit. None of our patients receive a bill for any of the services that we provide in our program. So it's fun so that we can continue operating smoothly. So aside from raising funds, it's really important to also raise awareness. Awareness in the community that these issues do happen right here in our backyards, in our communities, and raise awareness about this program that we have to offer at GBMC so that victims don't feel alone, so that they know that they have somewhere that they can go to seek treatment. So I would say personally the most important thing about this benefit is raising that awareness.
Now, I know that if you look at the logo over there, we have a red sneaker, but in the past we've had participants wear red high heels,
Yes.
whether you're a male or a female.
Yeah.
Do they still have to wear the red high heels? And also, how long is the walk?
So it's a 1 mile walk. It is not required that you wear red high heels, although a lot of people still do wear the red high heels in the walk. But you can really come out and wear any kind of shoes that you want to. Just getting out there and walking with us and, again, raising that awareness, that's what's most important about this event.
Once again, Laura Clary, Clinical Program Manager from our SAFE program. Laura, let me ask you this. We'll continue more on the event. But if anybody wants to find out some more information about the SAFE program and also just to get some details, what's the best way to do this?
So we have a really great website that you can visit at www.gbmc.org/safe, and you can go right to that website and be linked to a lot of resources in the community, learn more about what the nurses and the advocates do in our program, as well as any kind of contact information you would have about how to get a hold of someone from the SAFE program.
And also for those of for our viewers today who are joining us on Facebook in the audience, GBMC also has a Facebook page too, correct?
We do. So we have a Forensic Nurse Examiners at GBMC Facebook group that you can join. It is open, so you can just go in and put in a request, and then you can actually ask SAFE nurses different questions. You can learn about all the different events that we're having and some facts about our program.
Give that website one more time if you can, please.
The GBMC SAFE?
Yes,
Yeah.
yeah.
So it's www.gbmc.org/safe.
So you hear that, community members? If you need more information, that's where to go. Speaking of the community and our neighbors to the GBMC campus, how important is the community's involvement with the SAFE program, not just through Walk a Mile, but also other initiatives that you guys hold throughout the year?
So again, I think it's important to recognize that we are a nonprofit. So we rely so much on community support and very generous donors from the community that see the value in the work that we do and want to support the work that we do. So we rely heavily on our community, and again, just that awareness about this program. And we try to get out and do a lot of community outreach so that people do know the services that we have to offer. And I think outreach is a huge part of my job as well as the job of the forensic nurses that work for me.
I just want to repeat again, the services you offer to victims, there's no charge.
There's no charge.
Right? Okay.
Right. So the medical forensics and advocacy services that we provide are all free of charge for patients that come through our doors.
So for the funds that are raised, just one more time for our audience and those watching us on Facebook, the funds that are raised from Walk a Mile and other initiatives, how are they used within the SAFE program?
So we use them for a lot of different things. So one of the really great things that we're able to provide is getaway bags for our patients. So if we have a patient that comes in a domestic violence situation or a human trafficking situation, sometimes they come in with just the clothes on their back and that's it. So we're able to provide these bags that have, just things that we take for granted every day. So toiletries and toothbrush, undergarments, and sometimes we give them a cell phone so that they can safely communicate with the SAFE program as well as with law enforcement. In addition to these getaway bags, we need to keep the unit operating smoothly with trained SAFE nurses. So all of the funds raised too help us to stay staffed so that we can continuously train nurses to provide the service. And we train nurses not just for GBMC, but we've trained nurses from all over the country. We've had nurses travel here from Africa to take the course. We train physicians in the military. So it's a really sought-out training program that we offer at GBMC.
And I'm glad that we talked about these initiatives, because joining us in our audience today is, and I hope I get her name right, Mary Ellen Barthelme, who is a member of our philanthropy committee at GBMC. Mary Ellen, welcome. And also Dr. Fred Chan, who is also a physician at GBMC, but he's also the chair of the Walk a Mile event that's taking place this Saturday, April 21st, right?
That's correct.
What time?
So you can come and actually register as early as 8 o'clock and start in the pre-walk party. We'll have a DJ and breakfast and coffee, and then the walk actually starts at 9:30. But I recommend getting there earlier so that you can partake in some of the pre-walk events.
For those of us watching on Facebook, if you have any questions about the event or if you're interested in participating in the event, it is not too late, so please take advantage of the opportunity that's provided to you via Facebook to participate in the Walk a Mile event. My esteemed colleague, Greg, over there is waving the question mark there. Greg, you have a question for us?
Yes, we have a question from Facebook from Kristen. She says, what's the best approach with educating our children and instilling in them that they are allowed to say no, even to just a hug? Wondering how we can teach them and help them feel comfortable.
That's a great question, and thank you for whoever submitted that question. We appreciate it. Thank you so much. Laura?
So that is a really great question, and I think this is something that a lot of parents struggle with, is how do we approach this subject with our children? It's not an easy topic to talk about. It makes people feel really uncomfortable. But I think it's really, really important that you do initiate that conversation with your child, and you initiate it early. I think we so work to tell our children, you need to be really polite. If someone wants a hug, you give them a hug. And that shouldn't be that way. You know, you want the child to feel comfortable, and you want them to feel like they are in control of their body so that they can say, no, I really don't want to give that person a hug, and that is okay. It doesn't mean that the child is being impolite. And you're going to learn a little bit more this afternoon about some other techniques that you can use to initiate that conversation with your children. But I think it needs to be started early, and I think that another thing that we should talk about is using correct body parts when we're talking to our children about different areas, because that's huge when it comes to prevention and recognizing something like this happening.
That's a great point. Laura Clary, Clinical Program Manager for our GBMC Safe Program, joining us here today. And again, I encourage you all watching us on Facebook and audience members, if you have any questions, please send them on Facebook in the comment section, or for privacy reasons, feel free to send them via a private message on Facebook. And also, audience members, please find Mindy or Greg to submit your questions. We really would appreciate it. Greg, it looks like we do have another question.
Yes, we actually have 3 questions. So the first one is the program available 24 hours a day, 7 days a week to victims?
Yes, so it is available all day, every day. We never close. Our doors never close to patients. So it doesn't matter if it's 2 o'clock in the morning on a Saturday, if it's Christmas, if it's Easter, it does not matter. We always have a nurse and an advocate prepared to respond whenever a patient comes in that needs us. So we are always open.
Great.
Another question is there criteria to be seen by SAFE at GBMC, i.e. a police report, a referral, or off the street?
No, so there is no criteria as far as whether or not police are involved or if they just walk in on their own. There are different criteria as far as seeing a safe nurse based off of the time frame that the assault happened. So we can come in and provide forensic services for victims that come in within 5 days of the assault happening. But we also have a really great advocacy support program as well. So even if the assault happened months prior, if they come in through the hospital, we can still provide advocacy support, even though it's not within that 5-day time frame. When a patient comes through our doors, if they had just been assaulted, they will meet with a forensic nurse who will provide all the different options that that patient has. And those options do include if they would like us to contact police, or if they would like us to provide the service without police being involved, or if they're just there for a medical checkup. And we will help walk them through that process and allow them to take control of their own health care and make that decision.
That's sort of related to this next question, is what is the extent of follow-up with the victims after the incident?
So our main concern is safety, and the thing that we always ask our patients is it okay for us to give you a follow-up phone call? And we make sure that we get a safe number that we can call them back at, and we make sure that is it okay if we leave a voicemail? And we do after hours callback as well, because some victims cannot be called during the day for safety reasons. So they'll ask, can you call it after 6 o'clock at night? And that's fine. Anything we can do to make contact with that patient to be sure that they are okay and that they don't need any additional services. We do some medical forensic follow-ups on some of our patients that do meet that criteria, where they may need injuries or other things addressed in the future.
I want to thank our audience members for providing those questions. Laura, in our promo for today's show, we talked about, and well, we're excited about this, a great initiative that the SAFE program will be participating in later on this year, and that is with the Beau Biden Foundation, the Darkness to Light training program. Can you just touch a little bit about the program and what it means for GBMC Safe?
So we're super duper excited about this initiative, and what the program really is a facilitator-led training where we teach people how to recognize the signs of child abuse, how to prevent child abuse from happening, and what to do if you do recognize those signs, how to make a report, how to really stand up and make a stand to stop this from happening within our communities. We can open it to anybody, but we really want to target that audience that works around children day to day. So teachers, coaches, rec councils, places like that. It'd be great to have this kind of training, because I think a lot of times people are really afraid to speak up, or if they do recognize something happening, they're not really sure how to speak up and what to do. And this training program is going to help to recognize the signs and then how to respond to it.
Laura Clary, Clinical Program Manager with the GBMC Safe Program. Laura, I was going to ask you who's the target audience for this training program, but you kind of touched up a little bit in your response, but can you just repeat that? Who is the target audience for this?
So really it can be anybody, but who we really want to hit is that audience that works around children on a daily basis or work very closely with children. So again, coaches, teachers, rec councils, churches, daycares, places like that that have constant contact with children, so that those frontline people really get this training, because they're really working with these kids every single day.
Let me ask you this. How vital is this program to the mission of the GBMC Safe Program? How vital?
I think it's incredibly vital. Again, I think child abuse is a topic that people don't like to believe happens right in our community, and I think engaging in a conversation and really talking about the fact that, you know, child abuse and sexual abuse, they don't discriminate, and they can affect communities and people from all different walks of life. So really getting the word out there and spreading this awareness about this topic, I think, is so important to our mission.
I'm going to hit you with one more question, because we are going to talk about this in Greater Living later on with Mary Beth Marsden and Don Scott, as they have a representative from the Beau Biden Foundation on their program. But as the Clinical Program Manager for SAFE, also as a sexual assault nurse examiner and as a forensic nurse examiner, and again, as your role as the Clinical Program Manager, my goodness, you wear so many hats. But how would you like to see this program flourish within GBMC and within the SAFE program?
So I'm really excited and I'm really proud that GBMC sees the value of this program and is allowing us to bring it here to Maryland. And right now our immediate goal is to hit a huge part of Baltimore County, because again, right in our immediate community. But what I'd really love to see is it even go further than that and start expanding all across the state and all across other states. So I think it's really great, the fact that we are going to take the lead and really move this into Maryland and really push it out into the Baltimore community, and I'm really proud to be a part of that.
You're doing a great job, Laura Clary. Thank you so much. Laura
Thank
Clary,
you.
Clinical Program Manager for GBMC Safe. It looks like we have more questions from our audience. Greg?
We have a question from Facebook. We also have a question from our live studio audience, but we also have a comment on Facebook from Jennifer Schuyler. Laura and her SAFE team are amazing, and we are so lucky to have them at GBMC.
Well, if I could just comment about that for a second. So Jennifer is one of our child life specialists that work in the pediatric emergency department, and we so value the work that their team does as well. So anytime we have a child that comes in that has been abused, that needs to undergo a forensic examination, they are right there with us in that process. So they stay at the head of the bed, and they provide like play therapy and alternate focus for that child, so that while we are doing our exams, that child doesn't really realize what we're doing, and they can choose to focus on something else they enjoy, whether it be playing with a Barbie or playing with Play-Doh or something that makes them happy. So we really value the work that our child life specialists do and how they help us.
And before we get to the next question, I second everything Jennifer just said, so
Thank you.
It's well-deserved. Greg, do we have another question?
Yes, so 2 more questions. So one from Christy on Facebook. Are there tips for people who are being verbally abused or controlled by significant others to the extreme? What are the warning signs for physical violence as well?
So for physical violence, a lot of people always think that you're going to look for bruises and other things, but we don't always see that when it comes to domestic violence. And the signs may actually be invisible, and we may not be able to see it as far as a black eye or a broken bone. Of course, we do see that on occasions, but more often we're seeing patients who they don't really know who to turn to. And sometimes they're coming in through the emergency department for unrelated complaints, which they think are not related to domestic violence. So we see a lot of patients that come in with abdominal pain and GI complaints and headaches and anxiety, and all of that is stemming from the abuse that they are going through at home. So one of the huge things that we do right in the hospital is we screen each and every patient. So even if we don't see the physical signs of abuse like bruises, we're screening each and every patient in a safe environment so that they have someone that they can speak with right there at that moment. So statistics show that victims are more likely to come into a healthcare provider or an ER before they go to the police or to a shelter. So being a frontline responder in the hospital and being able to screen and recognize those patients and then providing an immediate intervention, I think is super important. And to let them know that they're not alone and that there are a lot of services out there for them.
Laura, we only got a couple more minutes before we end our programming, get ready for Greater Living. So let me go back to Walk a Mile in Her Shoes event that's coming up. Like I said, this is the 3rd time we've done this. In years past, what has been the response from the community and those participants, especially men that have participated in the program? What have you heard?
Everyone's really enjoyed it. So it's a lot of fun, and it's fun to see people out there walking this mile in red high heels. It's fun just to get out there and laugh and really raise awareness and come together as a group to walk this mile. And I think it's really, it's a fun event. And again, there's music and contests and prizes, and it's just, I think it's a great way to raise awareness about a topic that we really don't like to talk about.
And one more time, in case people are interested in registering, what's the best way that they can find out more information besides visiting the SAFE program page on Facebook, but also what's the website that they can look at?
So they can go to the actual Walk a Mile webpage. They can actually register right there, and that's at www.gbmc.org/walkamile. And if you can't register, you can still come the day of the walk and actually register that morning. Starting at 8 o'clock, you can come in and register and partake in the pre-walk party.
In your opinion, how has this program helped to address sexual violence, sexual assault?
I think it helps a lot, and I think, again, the community outreach that we do with the nurses getting out in the communities, into the schools, speaking at other hospitals about this service. I think since we do so much community outreach now, that we're seeing more patients who didn't know that this service was available to them, and now they know they have somewhere that they can go for help. So we've seen an increase in our volume, but I think that's because of the awareness that this program actually exists, which is really important.
Thank you, Laura. We do have time for just one more question before we end our program. Greg?
Yes, this question is from Laura on Facebook, and it's, are safe nurses involved in court cases for sexual assault victims?
Yes, we are. So we always say that the care that we provide to patients goes from the hospital all the way to the courtroom. So when we are doing these medical forensic exams, while we are addressing the medical issues that the patient is having, we're also collecting valuable forensic evidence and biological evidence that can hopefully link a suspect to the crime. And months down the road, we'll get a subpoena that will be needed in court, and we will go to court and we'll talk about what we do as a forensic nurse and how the exam is conducted and how we collected the forensic evidence. So we do testify as expert witnesses in Baltimore County Circuit Court and other courts around the area.
Laura, I really would love, I mean, we could go for hours talking about this, but I really want to appreciate you coming out today and joining us. Laura Clary, Clinical Program Manager from the SAFE program at GBMC. I also want to thank our audience members here today and those of you watching us on Facebook. Please stand by. The conversation about child abuse, sexual assault, and the Bo Biden Foundation Darkness to Light initiative will continue with my colleagues Mary Beth Marsden and Don Scott on Greater Living. Hey guys, how are you? It's good to see you off in the corner, and I appreciate you guys being so quiet back there. It's very nice of you. Again, I want to thank Laura. I want to thank you all. Next month, we're actually going to talk about cancer survivorship on To Your Health. Dr. Robert Donegan is joining us from the Cancer Center over at GBMC. I am so looking forward to talking about it because it's going to give you a perspective. We're kind of hoping we have a cancer survivor on our program to talk about survivorship. So again, I want to thank you all. I want to thank you those watching at home. And Laura, and to you all, cheers and to your health.